Have you ever noticed a soft, squishy lump underneath the skin after surgery or injury that wasn't there before? That might be a seroma, and although it can look and feel concerning, it's actually one of the more common complications we see in wound care and post-surgical recovery. In this video, we're going to cover everything you need to know about seromas, so what they are, why they happen, how they're treated, and what both nurses and patients should watch out for during the healing process. So let's get started. First, let's talk about what a seroma actually is. So a seroma is a collection of clear fluid called serous fluid that builds up under the skin after surgery or tissue trauma. It's made up of plasma, inflammatory cells, and sometimes lymphatic fluid. Think of it as your body's natural reaction to surgery or injury. When tissue layers are separated, small blood vessels and lymphatic channels are damaged. The body responds by leaking fluid into that space, almost like a blister under the skin, but deeper. This fluid can collect in the dead space left behind after tissue removal, liposuction, hernia repair, or mastectomies. Now let's go over how a seroma looks and feels so you can recognize it. Typically, a seroma appears as a soft, smooth swelling beneath the skin near a surgical site. It often feels like a fluid-filled pocket. It moves slightly when you press on it. The skin over the area may look shiny or stretched, and in some cases you may see a bit of clear or yellow drainage if there is a small opening in the incision. Most seromas are not painful, but they can cause discomfort or pressure. However, if the area becomes red, hot, painful, that could mean it's turning into an abscess or infection, which needs medical attention right away. So why do seromas form in the first place? There are a few common risk factors, making them more likely to develop when a large area of tissue has been removed or separated. There's excess movement or friction in the area after surgery. The drain was removed too soon, or if the patient has poor lymphatic drainage, obesity, or certain chronic conditions can affect healing, especially when there's a gap under the skin and the body isn't able to reabsorb the fluid fast enough that it collects and forms the seroma. Now let's talk about how the body normally deals with a seroma. So in many cases, the small seromas reabsorb naturally over time. The body gradually reabsorbs the excess fluid through the lymphatic system as healing continues. This can take anywhere from a few days to several weeks. It really depends on the size. During this time, you might notice the swelling gradually go down or even fluctuate slightly. That's normal as long as it's not painful, red, or warm. But what about larger seromas or the ones that aren't improving? So that's when treatment is needed. Here's what that might look like. So needle aspiration, this is when a healthcare provider uses a sterile needle and syringe to drain the fluid. Sometimes it needs to be repeated a few times if the seroma keeps refilling. Drainage placement, so if the fluid keeps coming back, a small drain may be inserted temporarily to allow continuous drainage. And lastly, compression or pressure dressings. So these help reduce the space where the fluid can collect and encourage reabsorption. As a nurse or caregiver, monitoring for changes in size, color, temperature, or drainage is key. And as a patient, it's important not to try to drain this at home. Always let a healthcare professional handle it to avoid infection. Now let's talk about the differences between a seroma and other post-surgical complications because they can sometimes be confused. A hematoma is similar, but it's filled with blood rather than clear fluid and usually appears darker or firmer. An abscess is an infection fluid collection, often painful, warm, red, and sometimes has cloudy or foul-smelling drainage. Knowing the difference helps guide proper treatment. So, what can be done to prevent seromas from forming in the first place? So, here are a few key strategies. Proper surgical technique. So, surgeons often place sutures to eliminate dead space where fluid can collect. Use of drains. Temporary drains allow excess fluid to escape while the tissues heal. Compression garments or dressings. So these help keep tissues snug together after surgery, limiting space for fluid to collect. And limiting strain and movement. Avoid heavy lifting, stretching around the surgical site until cleared by your provider. For nurses, gentle handling during the dressing changes and reinforce proper patient positioning can make a big difference. Next, let's touch on healing and follow-up care. Once the seroma resolves, whether it's naturally or after drainage, the area should be flat and the skin should return to normal. It's important to keep the incision clean, dry, and protected, and follow up if swelling reappears. Some patients are more prone to reoccurrence, especially after repeated surgeries in the same area. For those individuals, consistent follow-up assessments and good nutrition to support tissue healing is essential. And while we're talking about nutrition, it's something that's often overlooked, but it's actually one of the most essential parts of wound healing. Your body can't rebuild tissues, fight infections, or close a wound properly without the right nutrition. Protein, vitamin C, zinc, and hydration all play major roles in the repair process. Think of food as your body's building materials. Without enough of the right materials, even the best wound care plan can stall. If you'd like to learn exactly what to eat to support healing, I've created a wound healing cookbook that walks you through the foods, recipes, and nutrients designed to specifically help your body repair from the inside out. You can find the link in the description below. Supporting your wound from the outside is important, but supporting your wound from the inside is just as vital. So here's the key takeaway. A seroma is your body's response to surgical or trauma. It's not an infection, but it does need to be monitored closely. Most are harmless and resolve on their own, but when they grow, become painful, and show signs of infection, they require medical care. If you're a patient, don't panic. Seromas are common and treatable. And if you're a nurse, remember that patient education, early recognition, and proper documentation are critical for safe recovery. If you found this video helpful, please give it a like and subscribe for more wound care education. But that's all I got for this video, guys, and I hope to catch you in my next one. Bye for now. Don't forget to visit my website, thewoundconsultant.com, for all your wound care needs. Whether you're seeking professional wound care consultations, access to high-quality supplements, holistic healing, digital resources, informative books, or high-quality wound care supplies, we have everything to support you. Whether you're dealing with a wound or you're a healthcare professional, there's something for everyone. Visit today and take the next step in effective wound care.